Good morning, everyone. My name is Maya Luria with TMC for Seniors, and we're going to continue on with our Brain Health Month. Today, we're going to be talking about movement matters, the impact of neurological PT. I have Kirsten Shelby here with me. She is with our TMC Adult Therapies, and she has been working on this wonderful presentation that I think you're going to find really enjoyable to learn more about how we can impact our neurological system with physical therapy. So, welcome, Kirsten. How are you today?
I'm doing great.
Good. So
Are you ready?
You have an in-person audience and an audience at home. So if you're watching us from home and you're online today, please leave any questions in the chat for us, and then we'll address those afterwards. I'm going to go ahead and let you get started.
All right. So I don't know if all of you know, but March is Brain Health Month, so that's why we're talking a lot about the brain. But exercise is good for your brain. And it's not just the kind of exercise you might do doing a crossword puzzle, right? It's actual get up physical exercise, so physical activity. So when I talk about exercise today in my presentation, I am talking about physical activity. So you have to get up and get moving. So come on. Hello. Got a few more people joining us here.
There's always TV there.
Okay, good. All right, so we all know that exercise is good for your body, but exercise is also good for your brain. So, and like I talked about, that physical activity, moving actually matters. So they did a study where they took 3 groups of people. One group did aerobic exercise. One group did like cognitive training, so like crossword puzzles and cognitive puzzles on the computer. And then another group did some meditation using a mindfulness app on their phone. All of them did it for 35 minutes, but only the exercise group where people got up and got moving actually had a significant impact on improving the brain. So it's activity is more important for improving your brain health than actual, doing other activities. So like those computer games. So it's important to move is essentially what this study tells us. So the brain actually has physical changes when you exercise, when you're active. So it increases your blood supply to your brain. You grow new nerves when you exercise. It will improve your memory, and it can also improve your cognitive function. So things like being able to pay attention to something, how quickly you can process something. So if someone asks you a question, you have to figure out the answer, you can process it faster after exercising. And then all of your executive functions, right? So physical activity is very important for the brain. We're going to be talking a lot about the brain today, so I wanted to point out a couple important landmarks here. So some of the areas that we will talk about, does this have a laser pointer? Yeah, so one of them is your hypothalamus, right? So that little pink area there, so that area is really important for your memory, and more kind of the memory of things that you can name. Yes.
Point on the screen too for the online audience.
How?
Like step in front.
Oh, yeah. Okay. So like your hippocampus, that pink part. The other part, we'll talk a little bit about like your cerebellum. So that's important for your balance and your coordination. In your cerebral cortex, so up here we have your motor cortex and your somatosensory cortex, and that's important for movement and sensation. And then in here is your midbrain, so that's part of your brainstem. So we'll talk a little bit about the midbrain and the area in here when we talk about Parkinson's, okay? Any questions about that? We're good? Okay, so how does your brain make these changes? How does it improve things and grow new blood vessels? So these neurotrophic factors are what help us actually grow new blood vessels and new nerves in the brain. So we have your BDNF, or your brain-derived neurotrophic factor. So that one is important for helping protect your existing nerves, but then also it will grow new nerves and improve your memory, acting through that hippocampus area. Then we have your IGF-1, or your insulin-like growth factor, which helps improve your memory. It helps improve the plasticity of your brain, so the ability of the nerves to change their function. And then it also helps with some other nerve processes, but especially in the older brain, so as we age. It's an important one. And then your VEGF is your vascular endothelial growth factor. So it acts with the IGF-1, and it actually helps grow new blood vessels and nerves in the brain. So both of those are important. So all of these things are activated in your brain. So these are kind of like proteins in the brain that help mediate stuff going on with your nerves. Okay? Yeah.
What does trophic mean? Neurotrophic. What does that word mean?
Neurotrophic factors. So it's basically, it has to do with your nerves, right? So these proteins act on your nerves to help different processes happen in the brain. Okay. So we know that exercise is good for our brain. So activity, right? How much do we need to move in order to get these good benefits is the important question. So the easiest answer is we've done a ton of research on aerobic fitness and how to improve our aerobic and physical fitness, right? So they found when they took a whole bunch of people and they checked their aerobic fitness levels. So they did a study measuring their VO2 max of each person, and then they did a bunch of different cognitive tests on these people. And they found, and then they also did some MRI studies imaging their brain. And they found that the people that had better aerobic fitness actually had bigger brains. They had more brain cells. So they had more white and gray matter. So the white matter is more of kind of the myelin, or those nerve axons, and the gray matter is the body of the nerve cell. And I'll show you a picture of a nerve later on. But actually, so your brain is actually bigger when you exercise. So when you have better aerobic capacity. So to get better aerobic capacity, we have lots of good research on what helps you improve your aerobic capacity. So these are the World Health Organization's suggestions for sedentary persons, right? So if you've never exercised at all, this is what they recommend that you try and get in every week. So 150 to 300 minutes per week of moderate to vigorous aerobic activity, which translates down to about 30 to 60 minutes a day, okay? And then if you're under 65, they recommend also doing 2 times a week of strength training. And then if you're over 65, you do some strength training and you add in 3 days a week of balance training, right? So that's kind of their recommendations. However, if I look at the studies that just say how much do you need to exercise to stimulate some of these neurotrophic factors in the brain, the research isn't quite as clear, right? So they do know that BDNF, right, so your brain-derived neurotrophic factor, it increases with both short and long periods of exercise. And then once it has increased in the hippocampus, so in that memory area of the brain, it can stay there for up to 2 weeks after you have exercised. So it doesn't take a whole lot, and the effects actually last quite a while, which is good. So if we're just looking at kind of BDNF levels, they wanted to find out what kind of exercise is going to be best. So they compared high intensity interval training, so short kind of intense bouts of exercise for a minute and then a minute of rest, and they did that for 20 minutes, compared to someone who exercised for just 20 minutes straight. And they actually found that those short little bouts of exercise worked better to improve those neurotrophic factors in the brain than just doing one long sustained 20-minute bout of exercise. So it's okay to get little bits of exercise in all throughout the day. That can actually be more beneficial than doing one super long exercise. And they actually said that the study subjects who did the interval training liked it better than the people who had to just exercise for 20 minutes. So it was better tolerated. So that's a good thing. So it doesn't take a whole lot to get you moving. So how hard do you have to exercise? So when you look at intensity, I was going to include a slide about intensity, but basically you can grade kind of how intense is an exercise from 0 to 10, right? 0 is you're sleeping. 1 is you could do it all day, it's super easy, right? And then, so that'd be like mild exercise. And then if you get up to kind of that 3 to 6 level, right, is more that moderate. You're feeling like it's getting a little bit hard, you're breathing a little harder, but you can still carry on a conversation, you could still continue on. Intense exercise, so like high intensity, that 9 and 10, that's like you're running up a hill and you can barely breathe and you feel like this is the last thing that you can do, right? So how intense do you have to exercise to get the brain to work? So that, it wasn't very clear. So one study said that you could do very mild exercise, right? So maybe you go for an easy walk. And that it helped improve kind of your spatial memory. It helped improve the nerve growth in your hippocampus, so in that memory area. Another study said that moderate activity was better because if you exercise too hard, it elevated the stress hormones in the brain, so the corticosterone, and so you don't want to exercise too hard, right? A third study, they broke it down and they took 3 different, groups and they exercised them at 3 different intensities, and they found out that intensity didn't really matter because all of them improved all of those neurotrophic factors. So it didn't matter if you exercise super easy or if you exercise super hard. You're still improving those neurotrophic factors in the brain that help grow new nerves and new blood cells, right? So that's a good thing. Any little movement or activity is good for you, and it's good for your brain. So then we look at how long do you have to exercise for, right? So they took a bunch of subjects and they put them on a bicycle and they tested different things at each interval. So at 10 minutes, at 20 minutes, and at 30 minutes. So at the 10-minute mark, the subjects reported improvements in their mood, their vigor, their fatigue levels, so they had more energy at 10 minutes. And then at 20 minutes, the subjects said that they reported more improvement in those same 3 areas, so in their mood, their vigor, and their fatigue, but they also reported a decrease in their confusion. So it's clearing up your brain by getting moving. You're getting more blood flow up there. And then at 30 minutes, there really wasn't any more change in the brain. So from this study, we can conclude that 10 minutes is good, but if you can do 20 minutes of something, even better, right? So that's kind of our cutoff. Some other interesting things when I was looking through the literature, they found that exercises, so open skills, so something where you have to think and anticipate, so like playing badminton, right? It doesn't always come to the same spot. So you have to anticipate, you have to change directions, you have to move, you have to think. So it engages your brain in the physical activity. And that actually worked better to improve those neurotrophic factors than something like a closed skill, something where you do the same thing the whole entire time, like running or walking, right? Where you don't really have to think too hard about it. You're just doing the same thing. So if you can fit in some activities that include, challenging your brain a little bit and movement, you get even more improvement. Another interesting thing I found that the higher your aerobic level was to start with, the more improvement you had with activity. So when they measured some of those neurotrophic factors like the BDNF, there was a lot of variation between different subjects depending on how aerobically fit they were. So people that were pretty sedentary didn't have as much increase in those neurotrophic factors as someone who was really physically fit. Those neurotrophic factors increased much more rapidly. So there's a cumulative effect. So when you are active more often, right, when you improve your aerobic capacity, it's easier to get your brain working better, right? So that's why it's important to exercise frequently. So doing something every day. We want you to get up and move around. So we know that with just normal aging, there is a decline in nerve cell growth in your brain. So they say by middle age, so somewhere like 30s, 40s, right? You actually have a decline in how many nerve cells that your brain is making. But we can change that with physical activity, right? So even as we get older, we can still build new neurons in the brain with physical activity, right? So it doesn't matter your age. If you are active, it helps build those neurons in the brain. And then it's showing again, even if you're older and you have that higher aerobic fitness level, right? You're more active, you have bigger volumes in the hippocampus, so in that memory area of the brain, and they scored better at cognitive tasks. So another reason to stay active. So if we summarize that real quick, how much do you really need to exercise just to have impact on your brain? So not just for aerobic fitness, but just to have impact on your brain. So somewhere between 10 and 20 minutes. And we know that short periods of exercise are better than one super long period of exercise. So it could be that you include a 10-minute, walk a couple times a day, something simple like that to fit into your day. And they said that it doesn't matter how hard you exercise, right? It doesn't matter the intensity. So whatever feels good to your body. If you're not very active and you want to do something really easy and just walk around the house, vacuum, even housework is a pretty big physical activity. That helps your brain. And then we know that the improvements are cumulative. So the more that you exercise, the quicker your brain has positive effects from that activity, right? So what happens when something goes wrong in your brain, right? So the good news is we have something called neuroplasticity. So I talked a little bit about plastic, right? So it's not having plastic in your brain, it's the ability of the neurons to change their function. So that's what neuroplasticity is. So the neurons can change their function, their chemical profile, their structure, depending on what input we give it and what your body needs. So the brain can essentially heal itself from injury, which is a good thing. So neuroplasticity, it includes 3 different things. There's habituation, there's learning and memory, and then there's cellular recovery after injury. So we're going to just briefly touch on these things so you can kind of understand when we get to talking about more specific things that can go wrong in the brain. So I'm going to talk a little bit about stroke and a little bit about Parkinson's today. So 2 different neurological things that we treat a lot in physical therapy, or just all therapies, so occupational and speech as well. But habituation, basically those are short-term changes in the brain. So we use habituation a lot to kind of decrease the response to a specific stimuli. So in therapy, habituation might be used for, say, somebody was like hypersensitive to a touch. Like you had a surgery, you have a big scar there, and it's super sensitive to touch. So you can use habituation to get used to kind of different sensory input so that it's not so painful to you anymore. Or say we had someone come in that's dizzy. So some of the vestibular issues, sometimes we use habituation to help decrease your dizziness. So once we've kind of fixed the underlying causes of some of the dizziness, sometimes your brain, because it's kind of hardwired to feeling dizzy, you have to get it used to not being dizzy anymore. And so we use habituation in that and practicing some of the things that make you dizzy until it doesn't make you dizzy anymore, right? So these are changes in your brain to kind of decrease that response. So we can use those in therapy. Learning and memory are more long-term changes. So we actually build new proteins and build more synaptic connections. So more connections between nerves as a result of kind of training to that repetitive stimuli. So wanted to kind of break up memory a little bit because we talked a lot about the hippocampus. So the hippocampus is mostly responsible for remembering things that can be verbalized. So like remembering names, remembering, stuff that you can talk about. But you can also have memory in other areas of the brain too. So you can also have memory in the motor cortex, right? So that was in that gray part on top of the brain. And that will help you remember how to do something. So like riding a bike, like brushing your teeth, whatever activity is, like playing a musical instrument. And it can help you learn how to do those things. But it can also, you can have learning in your somatosensory cortex, so things that you feel. The cerebellum, so for balance and coordination, you can improve those things and have learning there. In your visual cortex, so processing that visual information, you can improve those things. So this is a positive thing for therapy because that means that if we work on these things, you can improvement. There are physical changes in the brain that happen as we do activity. So long-term potentiation, I just wanted to bring up this term, but that has to do with learning. So it's basically so there's a bunch of different connections in the brain. We call that a synapse. So the connection between 2 different nerves is called a synapse. And so sometimes the brain just makes a whole bunch of nerves and it doesn't actually activate all those nerves yet. So some nerves might not actually talk to each other. And we call those silent synapses. So they're not really sending messages to each other yet, but they have the potential to. So when we learn new things, right, when we give our brain the stimuli, it activates those silent synapses. And that's how long-term learning happens. So when we talk about the brain fixing itself later, this is how the brain fixes itself. So it builds new nerves and then it connects things, reconnects things differently, and it wakes up some of those silent synapses. So the nerves that weren't actually sending messages, to give them a new job to do now. So the area that was damaged, it stays damaged, right? but it builds new areas around that to take over that same function, right? So that's how our brain heals itself. And so long-term potentiation also includes improving the efficiency of how your brain works. So how all those nerves fire. So they get better at sending messages the more you exercise them. So we kind of talk about that like in therapy. I'll give the example of starting with like a bumpy gravel road, right? So as you start to exercise something, maybe your road is paved. And then the road turns, from a 2-lane road to a 4-lane road. And then it's like the freeway, right? The more you exercise it, so that message gets there so much faster. It doesn't have to go over those kind of bumps and potholes. So that's what learning does in your brain. So our nerves. This is an example of a nerve cell. So the kind of 3 main parts of your nerve cell. So we have the cell body. So the cell body, depending on your type of nerve, it could be in a different place. It could be in the middle here. It doesn't always have to be on the end. Today, mostly my examples, I'll have the nerve body on the end. The other important part on the nerve body is these little projections here. Those are dendrites. So that's receiving incoming information from other nerves. This long part here, this is the axon. So when the nerve gets a signal, so it gets that input information from your dendrite, so it receives some neurotransmitter, it's going to go down the axon. So it'll send an electrical signal down the axon. And so you notice the axon has all these little blue things on it, right? That's your myelin. So that's like a fat layer insulating the nerve. So if you think about wires, when we have wires like in our electric connections in the house, right? Your wires have like that plastic coating around them. That's to insulate it. So it decreases the resistance of that electrical current getting all the way from one end of the wire all the way to the other end. So the myelin, that fat layer, does the same thing. It helps insulate the nerve so that electrical message from here can get all the way down the axon more quickly. So if we don't have that myelin, so there are certain neurological conditions that attack that myelin, and that affects how well the nerve works. Right, so our myelin is important, and most nerves, not all, most are myelinated, right? But definitely the nerves in your brain, right? And then at the bottom here, those are your axon terminals, so the end of the axon. So that's for all the outgoing information. So that's what connects to the dendrites. Okay? So we talked about a synapse, right? A synapse is where 2 nerves connect together. So right here, but if we look really up close, so this is an up close of the synapse, they're not actually touching. They're really close, but not touching. So what happens right here to send a message from one nerve cell to the other is these things called neurotransmitters, right? So one cell will drop some neurotransmitters out into this open space, and then it will have some little receiving parts on the dendrites here. And so it will catch that neurotransmitter and then send the message via an electrical signal down through the nerve and through the axon to get it to the next nerve, right? So we talked about the synapses or the connections between nerves. Sometimes the body will do what's called synaptic pruning, right? So when a nerve is damaged, sometimes it gets rid of that synapse, right? Or if it's something that our body is not using and hasn't used for a long time, it might get rid of that synapse. And then we talked a little bit about those silent synapses, right? So where their 2 nerves, have their connection, but they're not actually sending and receiving any neurotransmitter yet. Okay? That doesn't happen until they are activated. Okay. So we had that beautiful, simple, example of what nerves look like, right? Where one nerve connects to the other, but it's not really that simple in the brain. So I just wanted to include this picture where it's a tangled web of a mess, right? There are so many different connections from one spot to another, and maybe they connect to multiple things, right? So this is why that recovery in the brain takes so long, because your body has to reorganize all of this, right? If it was just super simple, like the other picture, it would be quick, but it's not. So the last thing we talked a little bit about was cell recovery from injury. So this typically happens more with your peripheral nerves. So, but I did want to include it just because you could see that the axons, so if there was damage to an axon, so this is like your nerve cell body, and this is your axon, right? And this is where it connects to another nerve cell body. So if there was a damage to one of those axons, sometimes the nerve cell can actually regenerate a new axon. So just like a lizard grows a new tail, sometimes your body can actually repair that. And so that would look like this option. Sometimes it doesn't work, but what can happen is a nearby neuron can grow a new branch off their axon to innervate that same nerve, right? So our nerves are plastic. They can change. They can regrow. So this is a positive thing. This happens more commonly, though, kind of in like nerves that are in arms and legs, not as much in the brain, the spinal cord, because there's not as much of those neurotrophic factors to help with kind of that collateral sprouting, that regeneration, okay? That's more inhibited in the brain. In the brain, typically more it's that long-term potentiation. So those activating those silent synapses that are going to create more kind of changes and learning in the brain, okay? But I did want to include that. So now that we have the anatomy, we're going to talk a little bit about specific things that can go wrong in the brain. So if you listen to Dr. Teeple's talk, you'll get more of this, but I did want to talk a little bit about stroke because we see a lot of that in therapy. So with a stroke, there's two kind of main types of stroke. One is an ischemic stroke. So 80% of people who have a stroke, it's that kind of a stroke. So you have a blood clot somewhere in the brain, it blocks the blood flow to a certain area, and then that area of the brain dies, right? Because it's not getting blood flow, it's not getting those nutrients that it needs from the blood. The other option is a hemorrhagic stroke. So where the blood vessel actually bursts in the brain, and so then there's a bleed. It would also be similar to like if you had a traumatic brain injury, right? You hit your head really hard and there's a bleed in the brain, right? That blood in the brain, so not only the pressure of it can damage the brain, but also the area that's not getting the blood flow that it should have can get damaged. So because most of the strokes are ischemic, right, to where you don't have blood flow, a lot of our fixes for it are targeting that area because a lack of a blood flow in the body, it kills nerves, right? So without clinical intervention, about 120 million neurons, 83 billion synaptic connections, and 714 kilometers of myelinated fibers are lost after stroke, right? So it happens pretty fast. So that's why one of the most important things they can do after a stroke is to try to get blood flow back into the brain. So one of the most common things they might do is to try and get rid of that clot, right? So that's why they do a scan when you go into the hospital with a stroke, because they want to know, is it a bleed or is it a clot? Because if it's a clot, they can do something about it. So they might do something like give you, if it's within that 4.5 hour window, they can give you what's called TPA, or it's a recombinant tissue plasminogen activator, right? Which is why we have a nice acronym for it. And that is a really strong blood thinner that can bust up that clot and get blood flow back to the brain a little quicker. Sometimes they even go in and do surgery and take the clot out. Sometimes they just give you some type of blood thinner, right, to make the blood move easier through everything, because if your blood is sludgy and thick, it's going to have a harder time getting through those blood vessels, right? Yep.
Just like a heart attack, they say take an aspirin.
Mhm.
Well, if you can still swallow and you feel like you're having a stroke, should you take one aspirin? Would that help? Before they all come to help.
You could. Yeah. Yeah. Uh-huh.
Can they suck the blood out? I mean, if you have a big bunch of blood.
A big bleed.
Yeah.
So what they do sometimes for like a subdural hematoma or something is they might drill a hole in your brain to let off that pressure. So it's more because if you have a really big area of a bleed, the blood in there can actually put pressure, because your brain, it's a closed system. Your skull is only so big. So if you add a whole bunch of extra blood to one area of the brain, you know, where does the brain go? It gets smushed kind of up against other spots to make room for all that extra blood.
So the blood gets reabsorbed?
The blood will get reabsorbed over time, yes. So a lot of times with stroke, they don't do as much of that. With the subdural hematoma, it's kind of like a bruise on your brain, and so they tend to do more of those interventions where they, you know, create a hole, let some of that pressure come off of the brain. But yeah, there's not as much that they can do for a stroke when it's a hemorrhagic stroke.
Will you repeat what both those questions were?
Yes, so they were talking about if you had a bleed on the brain, so a hemorrhagic stroke, could they just take some of the blood out to kind of correct that? Yeah. Okay. And the aspirin, yeah, she asked about aspirin. So after a heart attack, they recommend taking aspirin. With an aspirin, you're probably fine. So because a heart attack, a lot of times it's caused by blood not getting through one of those coronary arteries to the heart, right? So a heart attack is like the heart not getting enough blood, whereas a stroke, a lot of times, is the brain not getting enough blood. So 80% of the time, you'd be fine taking an aspirin. So if you know that you tend more towards that ischemic stroke, taking an aspirin would be fine. If you are more of that, you know, have a history of aneurysms or, you know, things like that in your brain, you probably are more likely to have a hemorrhagic stroke where taking that aspirin would not be helpful, right? We don't want you to bleed more. So that's why they don't typically recommend it after a stroke, because they don't really know until you get to the hospital and they do a scan of your brain what kind of stroke that you have. Yeah, so it's not likely to hurt you taking an aspirin, but it's not recommended per se, but that's why. Because we don't know what kind of stroke you had. Does that make sense?
Yes.
Okay. So, again, Dr. Teeple is going to talk more about this probably next time, but that's why all of the acronyms having to do with stroke and reminding you what the symptoms are have something like fast, be fast, faster, right? Because the quicker that you react and get to the hospital and kind of get the clot taken care of, the less likely you are to have permanent damage in the brain. So we want to try and get you in. They can only use the TPA, so that clot busting drug, within a 4.5 hour window. Outside of that, it's really not as effective, and so they tend not to use it. Because the damage to those nerves in the brain has already been done. So getting things moving again, yeah, so that's why being fast is important. So you can read through kind of all those symptoms, but essentially, you know, a lot of times you'll have difficulty talking, difficulty walking, difficulty moving your arms. You might have paralysis on one side of your face, things like that. But the effects of the stroke kind of depend on where your stroke was in the brain. So the brain, after a stroke, can repair itself, right? We know that we have this neuroplasticity. What I found really interesting is how long it took for some of these things to happen, right? So your brain, it knows the priority is to get that blood supply going. So that's the first thing that it does, is within that first week, it's going to reestablish blood supply to the area. And then there's some different metabolic nerve processes that go on after that, right? So your body gets rid of kind of those broken, the nerves that were damaged, and they kind of recharge themselves, because we know nerves work with electrical signals. So there's positives and negative gradients. So they kind of recharge themselves, they get rid of the damaged cells. So that happens again within the first week. There's kind of cleanup happening, right? But then new nerves growing is a slower process. That takes about a month. So a nerve grows about 1 millimeter a day. It's really slow. So that means in a month, maybe you've grown 1 inch of a nerve, right? So in the brain, that might make a significant difference. But if you think about, some nerves go from your spinal cord all the way down to like your fingertips. Think of how long that nerve is, right? That's going to take a really long time to regrow and get all the way down there. So it depends on how long the nerve it is, how long it's going to take to show improvement.
But never feel bad when it happens, because I know people that were paralyzed on the left side, and it's like a miracle. They came around and you see them walking.
Mm-hmm. Yeah.
It's really a miracle. It takes a while, but it will happen.
There is a lot of potential, but yes, I think people feel like it needs to happen right away, but there are so many things going on in the brain to heal itself that it takes a long time. So a lot of times we talk about your recovery from a stroke. So the myelin repair, so repairing all of that, that's 3 months, right? Just to kind of re-insulate all of the nerves. And then all of that rewiring, that's at least 6 months. So we saw that really complicated web of nerves. Your brain has to rewire all of that. That takes time. So when we talk about recovery from a stroke, we're talking 6 months to a year to maybe even 18 months to see kind of what your potential could be. But even past that, you can still make some improvement if you work at things, right? Because we know that physical activity helps regrow new nerves in the brain. Mm-hmm.
Also, some physical therapists, well, even though I was a nurse for a long time,
Mm-hmm.
but I heard him say, in your brain, if you happen to be a tennis player, just pretend that you're playing tennis, even if so was there a study about that, using that brain vision with activity? Does that help better, or is it just helping the patient just think of something that they're used to doing?
It does help. So they have shown with studies that brain imagery, so imagining that action happening in your brain, stimulates similar areas as to actually doing the activity. So that's why like sports people, before a big event, they might imagine what it feels like, right, to doing their skill really well right before the competition. And that does help. It's like rehearsing it, right? So yes, imagery can help. Mm-hmm.
Is there a form of depression that accompanies strokes in general?
Yes, it can be more common with some other things, but yes, just because with a loss of function, I mean, you're going to feel a little more depressed, right? Because there's a lot of big changes chemically in the brain. I'm not yeah, there may be a link. I'm not positive on that one. With Parkinson's that I'm going to present on after this, there's definitely a link. There may be with certain kinds of strokes, but I think it tends to be more kind of like mood affected, right? Just that you're not able to do as much as you were, and so it lends people to being more depressed, but maybe. Okay. So your brain repair after a stroke, if you looked at it visually, it might look something like this, right? So kind of big and complicated. You have your nerve stem cells that make your 3 different kinds of nerves. So I didn't talk about these 2 kinds of nerves in the brain, But your astrocytes and your oligodendrocytes, they're like helper cells, but they are also counted as nerve cells. So we talked about kind of just the regular neurons with the white and the gray matter. Your astrocytes, they help with signaling between the nerves, and they also help with connecting like those blood cells to the nerves, or the blood vessels to the nerves. And then the oligodendrocytes help a lot with creating the myelin and rebuilding the myelin in the brain. But so your nerves kind of have their metabolic processes. They get rid of all the dead stuff, right? Or synaptic pruning. They start growing. They repair the myelin. And then they rebuild some of these big neural networks. So you can see how kind of there's all these other little cells in there too that kind of are involved. So it's a very complicated process, which is why it takes some time to recover, right? And it talks a little bit about some of those neurotrophic factors up there. Okay, so after you have a stroke, is exercise helpful? The answer is yes, right? So it improves all kinds of different outcomes after a stroke. So you can improve your aerobic capacity, you can improve your strength, your flexibility, your balance, depending on what things happen after the stroke. There are exercises to help combat some of those things, right? So if you have weakness, you can work on strengthening exercises. If you have tightness and increased tone and tension, you can work on stretching exercises. If you have just decreased aerobic capacity from being stuck in the hospital for however long, right? We can work on that. And then also like working on coordination and balance, like all of those things improve with exercise. They also shown that exercise can help with decreasing pain. So sometimes people will have pain after a stroke, right? Maybe that side has some different kind of neurological input and it hurts, or maybe they get shoulder pain, right? But they have shown that exercising actually improves the pain level. So it decreases the response to pain. So some of that habituation, right, that we talked about. But then it can also have analgesic effects, just moving. So like taking a Tylenol, right, you're taking an analgesic, you're taking a pain reliever. So just those processes in the brain and activating those neurotrophic factors can help decrease pain in the brain. So, which is really cool. So another reason to exercise. So when we talk about starting therapy after a stroke, it is good to wait a couple days, right? So when your brain is still doing all of that cleanup and repair in that first week, right? They've actually shown that it's detrimental to get up and really push somebody super hard in that first week because your brain's recovering. So generally about 5 days after is when it's a good to really start exercising. So that doesn't mean that you need to lay around in bed though for a week, right? So we don't want that. Like you can move. So doing, just gentle movements, all of your normal kind of daily activities, right? But we're not doing anything extra, right, to stress the body because we're letting the brain recover. So because a stroke is more of an acute process, right? The damage just happened. Your brain needs a little bit of time to recover. So typically when it's good to really start working on that therapy is about a week out after stroke. So like 5 days. But they showed, conversely too, that if you wait too long, so if you wait a month after, you still get improvements, right? You can get improvements at any point, but they're not as significant as the people who started at 5 days out. So it is important to start moving and exercising soon. You just have to give the brain a little bit of time to recover. Yes?
But it says starting the same day is poor outcome, but
Yes.
what happens is that hand is going to come and start contracting at the fingers. So they put, if people can realize when they're home by themselves or, caregivers,
Mm-hmm.
they don't put a gentle brace on there to keep that in straight out. So
Mm-hmm.
then that pain, they go into like contractions. So, or even at the elbow, so.
Yes, so when I talk about like not doing huge amounts of physical activity, I'm not saying don't do anything, right? Don't lay around in bed. But, some gentle moving, like that's okay. Some getting up, doing your normal stuff, like that's okay. Like you still want to move, but we're not like stressing you.
Paralysis of that hand.
Yeah.
To keep it even at bedtime, to keep it in a gentle, straight out the fingers especially, or like that, because eventually, even while you're sleeping, it's going to contract and it's going to be harder to be able when you do.
Yes, it depends on the effects, right?
If you could just keep any questions and comments until the end so that we can keep going too, because I want to make sure we have enough time to get through everything.
Yeah, it depends on the effects. Some people will be more kind of flaccid and floppy. Some people will be more rigid and tight. So it depends on the area of the brain that was affected. But again, I'm not saying don't move. You still want to move, but we're just not stressing therapy right away. Okay. So another neurological condition that's fairly common is Parkinson's disease. So Parkinson's disease, unlike stroke, it's a progressive disease. So it's not one acute thing that happened. It happens over time. And it's actually a degeneration of the basal ganglia. So the cells that produce the neurotransmitter dopamine that reside in the basal ganglia, they actually start dying, right? So that we have less dopamine. And so your basal ganglia is important for helping sequence movements. It regulates muscle tone and muscle force. So tone is like, how tight is your muscle? Is it floppy? Is it really rigid and tight? And so that's why with Parkinson's, we notice people get really stiff and tight, right? Because your basal ganglia has difficulty regulating that. It's also what we would call like a hypokinetic disorder, where you're not moving enough, right? You think you did this movement and it was this big, right? Because that regulation of force, so how much output you have to put in order to make this movement, is kind of decreased. So people think they're moving this big, but because they don't have that regulation in the brain of how much force is actually coming out, it only moves this much, right? So that's part of what we work on a lot with Parkinson's disease. So with Parkinson's, there's motor symptoms and non-motor symptoms. And you can kind of read through some of those on your own, but generally you have a lot of that stiffness. They have a lot of balance issues. Their facial expressions are really kind of muted. They might have trouble swallowing, and then there's all of the sleep problems, but they also have some trouble thinking and focusing, so that dementia, but Parkinson's related dementia, which is a little bit different from your normal aging dementia, also tends to happen. So there's several different stages of Parkinson's. So Hoehn and Yahr created staging for Parkinson's, and basically it shows kind of the progression. So maybe the stage 1, you have one side of the body is affected. Stage 2, you have both sides of the body is affected, and you have maybe only mild disability, right? Then it gets a little more severe. You have more difficulty with your balance, with standing and walking. Stage 4, you're very rigid. You can't live alone anymore. There are more severe signs. And then stage 5, you're in a nursing home, right? You need constant care. But I mention these stages because most of the time, by the time people are diagnosed with Parkinson's, they're already in stage 2 and 3, right? They're already fairly progressed by the time we actually diagnose the Parkinson's. And so unlike with the stroke, where your brain needs a little bit of time to recover, with Parkinson's, you want to start therapy right away. So the sooner the better. Even if you only have just a mild disability, it's better to start now than it is to wait, because you can actually delay some of that degenerative process with exercise. So this is just to show kind of what's happening in the brain with Parkinson's. So this is your basal ganglia. So when I talked about the midbrain, kind of in the brainstem there in the very beginning, this is a cross section of that. And so this is your substantia nigra. So this is where all the dopamine resides, and the dopamine is black, right? So you can see on the Parkinson's side, it's lost a lot of that black color, right? Whereas this one, it's nice and black and healthy. So that's what happens in Parkinson's is you don't have as much dopamine. And the other thing I didn't mention is you also get these kind of protein globs called Lewy bodies that your brain doesn't clear out. And so that's what helps kind of lead to some of that dementia, that Parkinson's related dementia, where you have difficulty kind of thinking and that attention issues. And your posture might look something like that, right? So you have this little shuffling walk and people get really stiff. So does exercise help? Yes, exercise helps. So they've shown that exercise improved that decrease of dopamine. So the wording in the study was a little bit funny, but essentially it's stopping that decrease, it's stopping that degeneration of dopamine. So it also reversed some of the expected decrease, right? So it can reverse some of those processes too with activity, with exercise. So physical activity is really good, and it shows that what dopamine you do have left, you actually use it more efficiently. You use it better after exercising, which can lead to an improvement in your Parkinson's symptoms. Aerobic exercise is also really good. So they've shown that 4 weeks of aerobic exercise showed long-lasting improvement with both motor and non-motor symptoms of Parkinson's. But you have to keep doing them, right? So because Parkinson's is degenerative, right? It's a progressive condition. If you stop, you lose all of those gains, right? You have to keep exercising in order to see that improvement and slow that decline in function. So there's a whole bunch of different types of exercises that you could do for Parkinson's that they've done some studies on. And it shows, so like Nordic walking, so that's like with the poles, right? You're walking with your poles. So they train people for 6 to 12 weeks. And they also train people like on the treadmill 4 to 8 weeks. But they showed that they had improved walking for 3 to 6 months afterwards, right? So that improvement lasted quite a while just from exercising. With balance training, so it decreased the amount of falls, it improved their balance, and that effect lasted for a whole year afterwards. Tai Chi for 6 months helped reduce symptoms. Dance therapy for a whole year reduced symptoms. And resistance training, it took 2 years to see a good reduction in symptoms. So these things are good, right? But sometimes they take a little bit longer than, say, the walking, right? But all of these exercises, so physical activity, helped reduce symptoms. So that's good. So there are 2 specific therapy programs I wanted to talk about with Parkinson's. I know we're kind of running short on time here. But so LSVT. So LSVT stands for Lee Silverman's Voice Therapy. So Lee Silverman was a fabulous lady with Parkinson's disease. And so Dr. Lorraine Ramey, she created a program to help improve the quality of your voice and the speech quality to improve communication. And so it's actually a fairly significant improvement. So LSVT, it uses a very specific research-based protocol where you exercise for an hour, 4 times a week for 4 weeks, right? And you see all of these improvements. So I wanted to show you a little video. So I'll show you one of their loud program, but they also have their big program. So they found that the loud program worked so well that they wanted to do something about some of those movement symptoms and the balance, right? So they translated it into LSBT big. And so they used big movements with bigger amplitude and bigger sizes of movements to retrain the brain. So it helped to recalibrate those movements. So using that long-term potentiation, right, the learning pathways in the brain, they were able to help people move bigger, right? And that lasts for several months afterwards, as we saw from the other studies. And their website is lsbtglobal.com. That's on there. But let me come down to, hold on, the video here. Wanted to show a video real quick of what it looks like. So before and after the LSBT loud. How do I make this? So you notice that she's just really flat here, right? There's not much facial expression. So this is before treatment. And this is after treatment. Mm-hmm. Mm-hmm. Yeah, but you can just see the huge change, right? She goes from being very flat and kind of quiet into this huge expression of facial expressions and just a big change. She talks faster, right? That's just from this therapy protocol, so of LSBT loud. The other one I wanted to show, where is it? So this is after the movement program. How do I get it to play now? It shows him at 3 points. There's before he did any treatment, halfway through the treatment, and then at the end of the treatment. But you notice the very far one, he's going the distance. The one in the middle. Yeah. So you notice a huge difference in how well they're moving, right? So just from doing some exercise, and it's
the same guy?
That was the same guy
Oh.
in all three videos.
Oh, I thought they were different guys.
No, the same guy. So the far left was before. The one in the middle was halfway through his treatment, and the one on the far right was at the end of his treatment.
If the disease is progressive, how come these people are getting better?
Neuroplasticity.
But it is progressive. I mean, you end up.
Mm-hmm.
It doesn't get better, but they're just getting. I just don't understand this.
Yeah, because when we do physical activity, it improves those neurotrophic factors. So even though you are losing dopamine in the brain, right, it finds new pathways, right, to do things. So we have that motor learning happen. We have a better efficiency of how they're using the dopamine that they do have.
But they're going to succumb eventually to Parkinson's, right? Not necessarily.
Yes, but it can improve their function short term, improve their quality of life, right? So it's not a cure, but it can help decrease their symptoms for a while, right? So people can go a lot longer and be much more functional and not get to that very end stage till quite a ways down.
Slows it down.
Exactly. Yeah. Another proven Parkinson's treatment that has a lot of research is called POWER, so Parkinson's Wellness Recovery. And we actually have the POWER gym. So Becky Farley, who created the program, she was one of the original therapists who helped translate LSVT loud into LSVT big. But she didn't like how rigid that rehab protocol was with LSVT. So she created her own using some of the same principles, and she called it POWER. And they actually have a gym here in Tucson. It's out on like Oracle and Wetmore out there. Really great place. But she essentially has 4 kind of power moves is what she calls it, but kind of 4 principles. So it talks about anti-gravity extension, right? So fixing your posture. There's weight shifting, so being able to shift weight from kind of one foot to the other. There's spinal mobility or twisting, right? If we're really stuck here, it's really hard to have good balance, whereas if we can move, right, we can move a lot easier and catch ourselves a lot easier. And then your power step, which is all about changing directions. So being able to go, to turn, to change kind of directions from one way to the other. So power more uses these kind of principles so that you can incorporate it into your everyday life, and it doesn't have as rigid of a treatment protocol. So we have therapists over at TMC that are certified in both POWER and LSVT big, and I've done both of those programs as well, so I have certifications. So in summary, movement is important, right? So we talked a lot today about how moving is good. You want to move every day. So the effects are cumulative. The more you move, the more efficient your body is at kind of feeding your brain. Any intensity works. So even the littlest bit of exercise to the most vigorous exercise, you're going to show improvements in the brain. Try and exercise for 10 to 20 minutes, but they found that short intervals throughout the day are actually better than one long kind of bout of exercise. But any way that you can get it in is good, right? So if you like doing, an hour-long walk in the morning, awesome, go for it. But if all you can get in are short little bits throughout the day, you're still helping your brain. Better aerobic fitness is better for your brain. You have more brain cells, so you can train your aerobic capacity, and that helps improve the size of your brain and how well it works. And then we talked about open skills, so pairing activities where your brain has to think a little bit and anticipate and kind of change direction. So things like badminton, right? Pickleball is huge in town, right? Pickleball would be a great activity for your brain. It's a physical activity, and you have to think about kind of changing directions and anticipating where the ball is going and planning. And then exercise, training of the brain is also task specific. So the more we train, so if we want to walk better, we train more walking, right? So it depends on what you want the brain to learn, what input you give it, right? All right. So now it's time for questions. Anybody else have any other questions? Online questions first? Okay.
Yeah, so I have a couple of questions. So this was great, and you provided so much incredible information. So somebody asked about, is there a study about how fast the brain responds to exercise? So can you exercise in the morning and feel smarter in the afternoon? How do you, or do I see a noticeable difference in a few weeks? How does that work?
Yeah, the effects are actually immediate. So when they did a lot of those studies measuring the levels of neurotrophic factor in the brain, they measured it directly after that activity. And it was improved directly after that activity. There is a bit of kind of an increase and decrease. So when you start doing an activity, it increases more rapidly. And then as you have been doing that activity for a while, that kind of decreases a little bit. because your brain, your body gets more efficient at using those neurotrophic factors to create new nerves and blood cells.
Great. Okay. How do you fix the myelin sheath? Was another question that came.
So the oligodendrocytes in the brain, they're more responsible for helping improve that myelin. But that's kind of, again, an automatic process. So the some of those neurotrophic factors, I believe the IGF can help with that a little bit, but those neurotrophic factors in the brain help kind of signal that the nerves need to improve and rebuild that myelin.
And I know it looks like it was about 3 months, you said, right, for that to rebuild.
Yes, it takes some time,
yes,
right,
okay.
for it to rebuild.
So and you sort of just touched on this a little bit about exercise, and is it helpful to learn new things while you're exercising? So for instance, should you try to learn a new language or try to memorize something, or are there other skills that you should implement while you're exercising?
You could, yes. So I actually came across a whole bunch of studies they did with school children and having them be active while they were learning something. And the kids who were doing a physical activity while they were learning something actually learned that thing better and faster than the kids who weren't doing a physical activity. So it may improve your ability to learn.
You're young.
Great. And I know we always talk about when you're exercising also to try different things so that you're not just doing the same thing, but you know, you continue to challenge yourself, right? So that you get those new experiences, which I think also helps in your brain health. Another question that came in, it was, why is it so hard to diagnose Parkinson?
Because there's not one specific test that tests for it. So, you know, for a while they were doing a little bit of like the DAT scan. So there's a certain brain scan that looks at how much dopamine your brain has. And it wasn't as, you know, predictive as they were hoping, but they still do it. A lot of times it's more diagnosed by that collection of symptoms. Right? And so that's why it takes so long. They have to rule everything else out before they decide that it's Parkinson's. And sometimes, too, they'll give you like medication. So one of the trials they sometimes do is they replace some of that dopamine and they see how much improvement you have in all of your motor skills. So I was going to talk about it a little bit, but we were kind of running short on time. But one of the pharmacologic things they do is they give you that carbidopa. Right, so they replace some of that dopamine and they see, does this improve your function? And so then that's a little more indicative of, yes, it's Parkinson's, right? Because you've lost dopamine.
Okay, and then Kirsten, I'm sorry, you cut out on me for just a minute. The last thing I wanted to ask before we close off with our online audience is, if somebody is interested in getting in touch and needs some sort of physical therapy, I wanted them to have the phone number. So we have the number, it's 520-324-7005. And that you're located over at our TMC Adult Therapies, which is just across the street from the hospital. And I know that you do specialize and see folks that have had strokes over there. So if somebody might be interested in that, do you want to share anything else?
Yeah, so the easiest thing to do is we do require a referral from your doctor because we are a hospital-based system. So you basically have primary care or whatever doctor send over a referral to TMC or whatever provider you feel like you want to use for physical therapy. And then once we receive the referral, we can work on scheduling you for an evaluation. You might have lost her.
Yeah.
I'm going to wrap up and let you take any in-person questions.
All right.
Does anybody have? Thank you so much for being here, Kirsten. Thanks again for being being here. I know we had a couple of Wi-Fi issues here at the end, so I apologize for that. If you are interested, we have another talk this week. It is behind the scenes, the bottom line on colorectal screenings. It'll be tomorrow, Wednesday, March 20th at 3 p.m. In addition, we did have a talk with Dr. Teeple on benefits of BFAST, reducing the damage of stroke. That class is actually moved to Friday, April 5th. You can still join us for it at 10 a.m. If you would like to get registered for that class, please give us a call. The phone number for both is 520-324-1960. Hope to see you again tomorrow. Thanks.